Hi everyone, I am Dr. Tejashi Burchalla, consultant doctor in Fidicus Homeopathy. Today we are going to discuss a very important topic, that is hormonal problems in women, especially related to menstruation. Menstrual health is a direct reflection of hormonal balance. Any disturbance in the cycle can lead to various abnormalities in the periods. So, understanding and early detection helps in preventing complications of hormonal imbalance. Let us discuss what are the menstrual problems related to hormonal imbalance. I can explain this more clearly on the board. Let's move on to the board. Hormones play an important role in regulating women's health. They can regulate the growth, metabolism, sleep, sexual health, fertility, and menstrual cycle. Any disturbance in these hormones can lead to various problems such as thyroid disorders, menstrual irregularities, hair loss, acne, body changes, that means weight gain or weight loss, and other fertility issues. Now, coming to the introduction part of this topic, does periods reflect hormone balance? Absolutely, it is correct because menstrual cycle is a natural indicator of hormonal balance in women. If she is having regular or normal periods, so it shows she is having normal hormonal balance. Does irregularities indicate health issues? It is also true. Irregularities like some women experience heavy periods, some are with scanty periods, it means scanty bleeding, some are having pain during menses, some are having infrequent periods. All these are the irregularities. These are not only signs of hormonal imbalance but can also be lead to underlying problems such as infertility, hormonal imbalance, and thyroid disorders. Early care prevents complications. It is true. Early diagnosis of the condition can prevent complications like infertility, thyroid disorders, hormonal imbalance, and other conditions. By menstrual cycle only, we can know women's health. Is there any imbalance in hormone levels or not? Now coming to the what are the menstrual problems associated with imbalance in hormones. Usually, hormones act as chemical messengers in our body. They can regulate when the period should come, how long it stays, how much bleeding it will occur. All these are regulated by the hormones. Now, we can discuss these conditions in detail one by one. Now, coming to normal or absent periods. Normal or absent period means in this eumenorrhea, amenorrhea is there. Eumenorrhea means women having normal cycle. It means ranges from 28 to 35 days, and the bleeding lasts from 3 to 7 days. This is the normal menstrual cycle and we call it as eumenorrhea. Now coming to amenorrhea. Amenorrhea means no periods. It is usually of two types, primary amenorrhea and secondary amenorrhea. Primary amenorrhea means a woman who is not yet menstruated even though if it is of 16 to 17 years of age. Primary amenorrhea means a woman who is not yet menstruated even though he is having secondary sexual characters of the age of 15 to 16 years. Now secondary amenorrhea. Secondary amenorrhea means women having normal regular cycles but she is not having periods for 3 months. Previously she is having normal cycles but now she is not having periods for last 3 months. These are the conditions involving normal absent periods. These are eumenorrhea and amenorrhea. These conditions are mainly due to hormonal imbalance. Now coming to infrequent periods. Infrequent periods means periods are not coming at regular times. In oligomenorrhea means delayed cycles. Usually, normal menstrual cycle ranges from 28 to 35 days. In oligomenorrhea, cycle ranges from more than 35 to 40 plus days. This is mainly due to hormonal imbalance. Sapin amenorrhea. It is a very rare condition. It can lead to severe complications like infertility. Annulation may be lead to other complications also. This condition is mainly due to hormonal imbalance in women. Sapin amenorrhea is different from oligomenorrhea because in oligomenorrhea, regular cycle with delayed time. But in sapin amenorrhea, it usually takes 2 to 6 months. Now coming to frequent scanty and excessive bleeding. In polyamenorrhea means frequent periods. It means cycle usually lasts less than 21 days. Some people complaining of I am getting 2 times of periods in a month. This is the condition. Polyamenorrhea may also lead to severe complications like anemia, weakness. All are getting by this polyamenorrhea. And also it is mainly due to hormonal imbalance, thyroid disorders and other problems. Hypoamenorrhea means scanty flow. In this, bleeding lasts only for 1 to 2 days. Some people may say I am having periods for one day and it lost. All these are coming to hypoamenorrhea. This is also due to hormonal imbalance. Now coming to heavy and prolonged flow. Hypermenorrhea and menorrhagia. Hypermenorrhea means heavy flow with normal duration. Cycle is normal and regular but having heavy flow. It will take, some are having 2 or 3 pads per day. In hypermenorrhea condition, people having more than 4 pads after that. All are included in hypermenorrhea. Heavy flow with normal duration. Menorrhagia. Menorrhagia means prolonged bleeding. Bleeding lasts more than 7 days or with clots. In this, cycle is normal, but bleeding is usually of long duration, 7 days or more. It can lead to anemic condition, weakness of the woman. All these are due to hormonal imbalance in the woman. Now coming to irregular and combined periods. In this, metrorrhagia, menometrorrhagia. Metrorrhagia means irregular bleeding between cycles. Cycle is normal but having irregular bleeding, regular cycles. It is caused due to hormonal imbalance. Menometrorrhagia. It is a combination of heavy and irregular cycles. Bleeding is heavy and also irregular cycles. We can call it as menometrorrhagia. These conditions mainly due to hormonal imbalance. In these conditions, women suffer with anemic condition, weakness. Now coming to painful menses. In painful menses, dysmenorrhea and cryptomenorrhea. Dysmenorrhea means painful menses. Usually, some pain is there during menses. Apart from that, there is severe pain, back pain, nausea. All these are included in dysmenorrhea along with backache. Dysmenorrhea is of two types, primary dysmenorrhea and secondary dysmenorrhea. In primary dysmenorrhea, pain is there without having any underlying pathology. But in secondary dysmenorrhea, pain with underlying pathology. Cryptomenorrhea, hidden periods. In cryptomenorrhea, periods will come at regularly, but we cannot see a bleeding. There is no visible bleeding in cryptomenorrhea. There is blocking of flow of menstrual fluid. In this person complaining of cyclic period pain, but having no visible bleeding, they complain of long-standing stomach pain with no bleeding. Now coming to other variants. In this spotting and vicarious menstruation. Spotting means light bleeding. Light bleeding occurs at regular intervals. It means in between the periods, there is slight bleeding occurs. Vicarious menstruation. In this, bleeding occurs other than uterus. It is usually from nose, gums and other mucous membrane. It is due to hormonal imbalance in the fragile capillaries of the mucous membrane. All these are the hormonal imbalance occurring in women. Now coming to when to see a doctor. Someone is facing from these symptoms. When you will consult a doctor, it means no periods more than 3 months. Usually, absence of period for more than 3 months, we can consult doctor. And also, very heavy flow. Usually, flow lasts for 3 to 7 days. When someone having more than 7 days bleeding, you can consult doctor. Very severe cramps affecting routine. Usually, some slight pain is there in menses. If it is disturbing the daily routine, you can consult a doctor. Spotting after menopause. Spotting after menopause means there is slight bleeding after menopause. It is a complication and it can also lead to cancerous condition. Period once in 2 to 6 months. If someone is not having period between 2 to 6 months of gap, you can consult a doctor. Regular bleeding between a cycle. Irregular bleeding between a cycle. In these conditions also, we can consult a doctor. All these are the signs where we can consult a doctor. If you are having these symptoms, don't neglect these conditions. Because if you neglect these conditions, it can lead to further complications like infertility, severe anemia, weakness, and other internal illness. It means chronic illness is there. So don't neglect these symptoms. Now we discussed menstrual problems related to hormonal imbalance, that is heavy bleeding, scanty bleeding, absence of periods, infrequent bleeding, all are now discussed. If you notice any of these symptoms, don't neglect because it can lead to severe complications in future. If you are suffering from these problems, consult Fidicus Homeopathy. At Fidicus Homeopathy, we are providing medicines with safe, effective and natural medicines. It can cure the condition from the root cause. If you want to stay healthy and balance your health condition, choose Fidicus Homeopathy. Thank you.